Book 1, Unit 1, The Physician Assistant. Exercise 5, page 5.
Career starter. Frequently asked questions. Is a physician assistant a doctor? No. Physician assistants, or PAs, are not doctors. However, they are licensed caregivers. Every PA assists a doctor. That doctor also supervises the PA's work. What do physician assistants do? PAs perform many of the same duties as doctors. They treat illnesses and injuries. They prescribe treatments and perform therapy. Why do we need physician assistants? Every year, the number of patients increases. Doctors can't handle them all. PAs handle general care. This allows doctors to handle more complicated cases. How are physician assistants different from nurses? PAs and nurses both assist doctors, but PAs have more training. Furthermore, nurses cannot diagnose illnesses or prescribe medication.
Unit 2, The Hospital. Exercise 5, page 7.
BN Brighton News. Construction begins on Central Hospital. Construction started on the new Brighton Central Hospital today. The hospital will save Brighton residents a lot of travel time. Currently, Green Hospital is the closest facility with surgery, orthopedics, and cardiology departments, but it is 50 miles away. It is also the only dermatology treatment center, but Brighton Central will have all of those departments. Families will be pleased to know there will also be new pediatrics and obstetrics wards, and several of the new hospital's departments will run 24 hours a day. They include the emergency department, pathology, radiology, and pharmacy. Brighton Central will handle any emergency, anytime.
Unit 3, Hospital Staff. Exercise 5, page 9.
Blogworks. Life as a PA by Jason Leonard. Who you work with. June 18. As a PA, you see your supervising physician daily, and you'll always need help from nurses. But you'll interact with other hospital staff members too. For example, I work in a general practitioner's office, but I send patients to radiologists, pharmacists, and lab technicians every day. Other doctors you see less often, but when you do, it's probably very important. Say it's regarding a patient who needs heart surgery. You'll likely consult with a cardiologist, surgeon, and anesthesiologist. Of course, not all consultations are about bad news. You also get to speak with obstetricians and pediatricians about newly pregnant patients. Those are my favorite days.
Unit 4, Equipment. Exercise 5, page 11.
Employee Handbook. Physical Examination. Brighton Central Hospital. Equipment. Each examination room has basic equipment. Latex gloves and tongue depressors are in the cabinets. Specimen cups are in the first drawer. Syringes are in the second drawer. This drawer must be kept locked at all times. Dispose of used syringes in a sharps container. Sphygmomanometers, ophthalmoscopes, and otoscopes are locked in the main supply cabinet. Note: Brighton Central Hospital does not supply all examination equipment. Doctors, PAs, and nurses should carry their own stethoscopes. The same is true for pen lights and reflex hammers. We recommend labeling your personal equipment.
Unit 5, Anatomy 1. Exercise 5, page 13.
Physician Assistant Quarterly. What are we seeing? Thomas Green, PA. This year, PA Quarterly is studying the most common injuries that PAs treat. We surveyed 1,000 PAs to see who they are treating and for what. In this edition, we're checking the limbs. For the arm, wrist injuries were most common. Next on the list were elbow injuries. Fingers and hands were next. Shoulders received the least amount of care. For the legs, toes had the fewest injuries. The most often treated area was the knee. Patients had ankle issues just slightly less often. Hips and feet were treated with about equal frequency.
Unit 6, Anatomy 2, Exercise 5, page 15.
Patient, Greg Baker. PA, Karen Rogers. Reason for visit, pain in torso. Cause of injury, if known. Mr. Baker was in a car accident last week. Exam notes. Mr. Baker feels pain in several locations. He has a sharp pain between the shoulder blades. It extends up to his neck. He also has minor pain in the small of his back. Mr. Baker reports pain in his abdomen and groin as well. The pain is worse just below the rib cage. He has no reports of pain in his chest, fortunately.
Unit 7, Anatomy 3, Exercise 5, page 17. Patient assessment. Patient, Alan Green. Sex, M. Age, 32. Description of injuries. The patient fell off of a moving bicycle. He was wearing a helmet, so there are no serious head injuries. He does have minor injuries to the face. He has a small bruise on his jaw. The patient has one deep cut. It begins at the forehead and moves down into the eyebrow. His eye is undamaged, but the cut will require stitches. His nose is swollen but not broken. Both lips have small cuts and are swollen. His cheek and ear have minor scrapes. Unit 8, Anatomical Directions. Exercise 5, page 19.
Anatomical directions. Medical emergencies require clear communication. Terms like right or left aren't clear enough. After all, left and right depend on who is talking and what direction people are facing. To avoid such confusion, medical professionals use anatomical directions. For example, a body part is not in front, it is anterior. The opposite is posterior. Similarly, a part that is higher than another is superior. The opposite of that is inferior. Check the list for more pairs of opposites. Cephalic, toward the head. Opposite, caudal, toward the feet. Proximal, closer to the trunk. Opposite, distal, further from the trunk. Lateral, away from the center. Opposite, medial, toward the center.
Unit 9, Circulatory System. Exercise 5, page 21.
How the circulatory system works. The circulatory system carries oxygen and blood to all parts of the body. Blood begins its journey in the heart, which beats to pump it to the rest of the body. Valves control how blood moves through the heart. Blood picks up oxygen in the lungs by traveling through the pulmonary artery. It then returns to the heart and leaves through the aorta. This is the body's largest artery. Blood flows throughout the body in arteries. At the end of arteries are tiny capillaries. Here, oxygen moves to other parts of the body. Blood without oxygen returns to the heart in veins. The largest of these, the vena cava, empties into the heart's right atrium. From there, it once again travels through the pulmonary artery and the cycle repeats.
Unit 10, Respiratory System. Exercise 5, page 23.
The respiratory system. Your respiratory system is always at work. Most of the time you don't even notice it, but every time you breathe, an important process takes place. This process is called gas exchange. When you inhale, air passes through your bronchial tubes into the lungs. Oxygen is in that air, and your body needs it to function. It is absorbed by special structures called alveoli. This is the first step of gas exchange. But there's another step. Alveoli also release a common waste product, carbon dioxide. As you exhale, that waste is removed from the system. That's one reason why smoking is so harmful. It damages alveoli and limits gas exchange.
Unit 11, Digestive System. Exercise 5, page 25.
The digestive system. Once food enters the digestive system, it passes through several organs. Each stage breaks food down or absorbs nutrients. The digestion begins in the mouth. From there, food passes into the esophagus. The epiglottis prevents food and liquid from entering the airway. The esophagus leads to the stomach. And from there, food enters the small intestine. This is the point at which the gallbladder injects bile into the system. That substance further breaks down food. Food moves from the small intestine to the large intestine. Finally, the remaining material enters the colon. It is held there until it leaves the system through the anus.
Unit 12, Integumentary System. Exercise 5, page 27.
Take care of your skin. We often take our skin for granted, but it's the foundation of the integumentary system. It's also our largest organ, and it's more complex than you might realize. It's made up of 3 layers. The top layer is the epidermis. This layer is tough because it contains keratin. That protein also forms your nails. Sweat passes through pores to cool the epidermis. The dermis comes next. And the deepest layer is the hypodermis. This layer is mostly subcutaneous fat. Together, these 3 layers provide protection from infection and punctures.
Unit 13, Common Abbreviations. Exercise 5, page 29.
Brighton Central Hospital. Patient, James Dent. Patient condition, stable. Patient vital signs. T, 99.8 degrees Fahrenheit. HR, 80 beats per minute. BP, 142/93. Respiration. Patient COSOB. Notes. XR shows no blockage in lungs. Blood oxygen is WNL. OE patient appears to have high levels of anxiety. The patient is a smoker. He also sits at a desk most of the day. DX. The patient likely has HTN, but further testing and lifestyle analysis will be required. RX options will include changes in diet and exercise. Medication may be prescribed later if the lifestyle changes fail to achieve results.
Unit 14, Measurements. Exercise 5, page 31.
Anderson Nursing Home, Medication List, Ward 7. Pascal, D, 40 MEq potassium chloride by mouth twice a day. 1 milliliter, 1 cc insulin injection after dinner. Holmes, F, 2 drops saline solution in each eye every morning. Paulson, G, 2 teaspoons of fish oil by mouth every afternoon. Roberts, R, 1 tablespoon of dextromethorphan, DM, by mouth twice a day. Take for 5 days or until cold subsides. 2 grams omega-3 by mouth every morning. Francis H. 20 milligrams fluoxetine HCl by mouth at breakfast. Harrison K. 500 micrograms cabergoline by mouth every night before bed. 1 tablespoon of fish oil by mouth every afternoon. Tracy A. 2.5 ounces medicinal toothpaste every morning and night.
Unit 15. Describing frequency. Exercise 5, page 33.
Observation. Patient medications. Brighton Central Hospital. Paul White. Mr. White requires hydrocortisone QOD. Robert Green. Give Mr. Green 200 milligrams of acetaminophen TID. These should be taken AC with water. Greg Anderson. Mr. Anderson requires injections frequently. QID. If his heartbeat is irregular, give him a 25 cc injection of lidocaine, STAT. Notify the physician on call right away. Ann Smith. Mrs. Smith can have ibuprofen PRN. She must take it PC, so bring some food with it. She should also take her antibiotics QHS. Carol Thompson. Ms. Thompson needs steroid injections BID in the morning and night. Her IV drip should be exchanged QH.
Book 2, Unit 1, Nervous System. Exercise 5, page 5.
The nervous system. The nervous system is an incredible network. It coordinates the actions of the body and transmits information from one part to another. Neurons form the core of the nervous system. Other parts of the nervous system, such as the brain, are built from these. Neurons, or nerve cells, can transmit information by both electrical and chemical signaling. They connect to each other to form neural networks, which perform specific functions. Such networks are capable of massive amounts of information processing. Different types of neurons serve different purposes. Sensory neurons react to stimuli from the sense organs, such as light or sound. Involuntary reflexes are triggered by such stimuli. Motor neurons help the body move. The brain and the spinal cord form the central nervous system. Information travels through nerves and up the spinal cord to the brain, which controls all of the body's systems. The spinal cord is surrounded by the vertebrae of the backbone.
Unit 2, Endocrine System. Exercise 5, page 7.
About the endocrine system. The glands of the endocrine system work together to control many bodily functions. Everything from hunger to childhood growth is regulated by the hormones of this system. Each gland of the endocrine system secretes one or more hormones into the bloodstream. The hormones travel throughout the body to control certain functions. Major glands of the system and their purpose include the following. Pituitary gland. This gland, at the base of the brain below the hypothalamus, secretes 9 hormones that control important functions. These include growth, blood pressure, and sexual functions. Thyroid gland. The thyroid gland, in the neck below the Adam's apple, controls how quickly the body uses energy and makes proteins. Pineal body. The pineal body or pineal gland is located in the center of the brain. It produces melatonin, which regulates sleep cycles. Adrenal gland. One adrenal gland is located above each kidney. They produce adrenaline, which helps the body respond to stress.
Unit 3, Reproductive and Urinary Systems. Exercise 5, page 9.
Chapter 12, Study Guide. The reproductive system. The reproductive system is a system of organs that work together in order to produce offspring. Important parts of the reproductive system are the genitalia and the gonads. The genitalia are the sex organs that are involved in reproduction. This term often refers to the external reproductive organs. The gonads are the organs that produce sex cells. In men, the testes produce sperm. They are also part of the male external genitalia. In women, the ovaries are internal organs that produce eggs. The urinary system is the group of organs that create and expel urine. An important part of the system is the kidneys, which filter waste from the blood. Urine is the liquid waste formed in the kidneys. It moves from the kidneys to the bladder through tubes called ureters. Urine collects in the bladder until the body expels it through the urethra.
Unit 4. Skeletal and Muscular Systems. Exercise 5, page 11.
Chapter 22. Major Systems. 2. The skeletal system. All vertebrates have an endoskeleton. This means that the skeleton is inside of the body. See Chapter 23 for information on exoskeletons. Individual bones work together to form a basic body structure. The exterior of the bone is composed of hard, compact bone tissue. This provides support and protection for softer tissues. The interior of the bone is composed of spongy bone. This softer tissue often contains marrow. Marrow produces blood and lymphatic cells. 3. The muscular system. There are 3 primary types of muscle that make up the muscular system. These are smooth muscle, cardiac muscle, and skeletal muscle. Smooth muscle is involuntary. It is found in the blood vessels, esophagus, and other organs. Cardiac muscle is a special type of muscle found only in the heart that allows it to pump blood. Skeletal muscle is voluntary. It works with the skeletal system to create movement and body heat.
Unit 5. Types of Tissue. Exercise 5, page 13.
Find out what you're made of. The human body is an extremely complex system. It performs an astonishing variety of functions, and a great majority of them are automatic. But here's something that might surprise you. The body does all of this with only 4 types of tissue. Epithelial tissue forms the lining of many of the body's cavities. It also makes up many glands. Epithelial cells are attached to a base membrane. Connective tissue connects, separates, or supports other types of tissue. Some examples are cartilage, ligaments, tendons, and blood. The brain and spinal cord are composed largely of nervous tissue. They make up the CNS, or central nervous system, CNS. The CNS sends messages to the rest of the nerves in the body. This extended system is called the peripheral nervous system, PNS. Muscle tissue makes up all the muscles in the body. This includes both voluntary and involuntary muscles.
Unit 6. Patient History. Exercise 5, page 15.
Medical History Guide. As a medical professional, you should be prepared to take thorough medical histories. The data you collect reveals important details about a patient. Doctors use these details to uncover likely causes of medical conditions and establish diagnoses. First, obtain consent. Then, get as many details as possible about a patient's complaint. Find out if the patient has a history of the condition. Ask when the patient experienced the onset of symptoms. Then find out about the patient's past medical history. Record any previous medical problems, especially those that could relate to the current condition. Other details can also contribute to a useful medical history. A good social history includes information about the patient's personal habits and lifestyle. A family medical history reveals conditions that are more likely to occur in a particular family. Before any medical procedure, make sure you have an updated record of the patient's allergies. This way, you avoid exposing patients to medications or substances that might harm them.
Unit 7, Physical Examinations, Exercise 5, page 17.
Giving a physical examination for providers of medical care. An annual physical is one of the most basic of medical care procedures. Follow these simple steps to be sure that your assessments are thorough and effective every time. 1. Make sure the patient is comfortable and that the examination environment is optimal. 2. Check vital signs. With the patient sitting, take his or her temperature using an oral thermometer. Then measure the patient's pulse. Use a stethoscope to conduct an auscultation of the patient's breathing. 3. Have the patient lie down. Use percussion techniques to check the condition of organs beneath the abdomen. 4. Conduct a general inspection of physical body parts. Check the arms, legs, back, and neck with palpations. Evaluate the patient's posture. Make observations of the patient's body language.
Unit 8, Vital Signs, Exercise 5, page 19.
Brighton Central Hospital Observation Sheet. Patient name, Michael Brown. Sex, male. Room, 132A. Primary physician, John Harper. PA, Karen Harris. Exam performed by Karen Harris. Time, 12:30. Patient condition, stable. Patient vital signs. Body temperature, 99.6 degrees Fahrenheit as taken by external artery thermometer. Heart rate, 82 beats per minute, resting rate. Blood pressure, 122 systolic, 79 diastolic. Respiration, exhibiting eupnea. Notes, no issues to report. Patient name, Sarah Owens. Sex, female. Room, 132B. Primary physician, John Harper. PA, Alan Smith. Exam performed by Alan Smith. Time, 12:45. Patient condition, serious. Patient vital signs. Body temperature, 102 degrees Fahrenheit as taken by external artery thermometer. Heart rate, 90 beats per minute, resting rate. Blood pressure, 133 systolic, 98 diastolic. Respiration, frequently exhibiting apnea. Notes, patient may need assistance of respirator.
Unit 9, Symptoms, Exercise 5, page 21.
Patient, Karen Michaels. Provider, Alan Green, PA. Notes. Patient presented today with discomfort in her head and body. She said she was treated for a cold last month by another doctor and she was worried it might have returned. Once again, she has a runny nose and is coughing. She is experiencing severe fatigue and difficulty concentrating, also as before. However, she is now also wheezing and having trouble breathing. She also reports feeling sore all over her body. She also talked about a headache that throbs. The pain and labored breathing are preventing the patient from sleeping comfortably. A temperature reading indicated a fever of 102 degrees. I advised the patient that her symptoms suggest the flu rather than a cold. I recommended an over-the-counter analgesic to relieve pain and reduce the fever. I also advised the patient to stay home for 2 to 3 days until she feels stronger. The patient will return in 7 to 10 days if the symptoms do not improve.
Unit 10, Describing Pain, Exercise 5, page 23.
Pain Assessment Form. Patient name Arnold Feely, age 39. 1. What is the location of the pain? Lower back. 2. How does the patient rate the intensity of the pain? At best, moderate. At worst, unbearable. Right now, excruciating. 3. How often does the pain occur? Patient reports that the pain started out as intermittent several years ago. However, recently the pain became constant. 4. What is the nature quality of the pain? Example, burning, throbbing, etc. Patient reports constant throbbing throughout the day. In addition, when he stands up, he feels a sharp, shooting pain travel up his back. 5. What causes the pain? Patient works as a mechanic. He says that he spends 6 to 8 hours a day bent over looking at cars. 6. What does the patient do to relieve the pain? Patient uses a heating pad for several hours each day. He also takes at least 4 aspirin pills a day. 7. Other comments. Patient was in some distress today when he came in. He says that the pain is negatively affecting his performance at work, as some days he is barely able to stand.
Unit 11. Diagnostic Tests. Exercise 5, page 25.
Brighton Central Hospital. Patient name, Dennis Hayes. Tested for chronic kidney disease, CKD. History. Mr. Hayes reports a low appetite and little energy. His family history includes kidney problems. This led me to check Mr. Hayes' renal function. Test results. A urinalysis shows a high level of albumin. Additionally, creatinine levels are much higher than normal in blood tests. Diagnosis. Mr. Hayes likely has kidney disease. I have concerns that it is progressing towards renal failure. Recommendations. Order a GFR test and a BUN test. A renal biopsy should be scheduled as soon as possible to determine the cause of the disease. The pathology report should be sent immediately to my office as well as Dr. Reed, room 212, second floor.
Unit 12. Diagnostic Equipment. Exercise 5, page 27.
Hewlett Medical, an industry leader. Diagnostic equipment. When it comes to diagnostic equipment, you can trust Hewlett Medical. Our products assist medical professionals and patients in a variety of settings. Our equipment creates visual presentations of things you couldn't see otherwise, both large and small. For example, our ECG and EEG devices show healthcare professionals what the heart and brain are doing. And our spectrophotometers help test nucleic acids. We also manufacture point-of-care testing devices. Our glucose monitors assist diabetics around the world. Our oximeters are standard equipment in many hospitals. But Hewlett Medical is always pushing forward. We're combining biosensors to provide more information in less time. Our goal is to combine thermal sensors, mechanical sensors, optical sensors, and electrical sensors into a single device. Someday, we hope a single scan will tell medical professionals everything they need to know.
Unit 13. Imaging Equipment. Exercise 5, page 29.
Radiology Department. Welcome to the Brighton Central Hospital Radiology Department. We are the region's most advanced medical imaging center. As such, we offer a range of services. We offer several forms of radiography. We can use X-rays to create a standard image, but we also offer CT scans. When you get one of these, you'll enter a machine that uses many X-rays to create a 3D image. Our PET imaging technology shows a 3D image too, but it does so by tracing radioactive molecules you ingest. As with PET imaging and the CT scan, patients enter a machine to receive an MRI too. However, unlike those procedures, the MRI relies on magnetic forces, not X-rays, to create an image. We also provide ultrasounds at this facility. A technician will apply gel above the area to be imaged. You can actually see the images as they are produced. An ultrasound image is not as clear as an MRI or CT scan, but our technicians do their best to provide good contrast and reduce noise. Our department also provides assistance in procedures with endoscopes. However, these procedures are not conducted in our offices. In these circumstances, a doctor feeds a tube with a tiny camera on its end directly into the organ or cavity to be examined.
Unit 14, Types of Medication, Exercise 5, page 31.
Patient, Alan Smith. Date of birth, 1/14/1973. Prescription history. Reason for visit. Medication, dose. 04/1998. Patient has severe allergies. Prescription, antihistamine, 10 milligrams daily. 5/1999. Patient complaining of constipation. Prescription, laxative, 50 milligrams in suppository form, 1 dose. 02/2001. Patient arrived with a twisted ankle. Prescriptions, anti-inflammatory, 120 milligrams twice a day. Painkiller, 100 milligrams every 6 hours or as needed. No refills. 08/2008. Patient admitted for appendectomy. Prescriptions, sedative, 25 milligrams before bed. Painkiller, 150 milligrams every 4 hours. Antibiotics, 200 milligrams 3 times a day with meals. 11/2009. Patient diagnosed with depression, difficulty staying awake. Prescriptions, antidepressant, 170 milligrams daily. Stimulant, 40 milligrams daily or as needed.
Unit 15, Maintaining Hygiene, Exercise 5, page 33. Practice good hygiene. Don't let an infection spread. We can all do our part, staff, visitors, and patients. Our staff provides a safe environment. We dispose of all biohazards in specially marked bins, and each room is thoroughly cleaned with disinfectant every day. When you enter a room, always wash your hands with an antimicrobial soap. The point is to eliminate any bacteria you might have on you. We also provide hand sanitizer outside each room. Using it after touching doors or other shared items is a good practice. Some areas require additional precautions. The life of some patients depends on a sterile environment. In these areas, face masks are required. The same rule applies for patients that are quarantined. These patients are isolated to prevent them from transmitting a dangerous illness to others. Only required staff members should enter a quarantine area, and they should only do so with proper protective gear. Unfortunately, patients in quarantine are too contagious to have visitors. Book 3, Unit 1, Education and Training, Exercise 5, page 5.
www.ufa.edu/healthcarecareers/physician assistant. Physician Assistant Program. Thank you for your interest in our Physician Assistant Program. Physician assistants perform many important tasks under the supervision of a doctor. These tasks include diagnosing patients, prescribing medication, and providing patient care. The requirements for entry in our program are as follows. Applicants must have a BA or BS from an accredited 4-year college or university. Admission to our program is competitive, so applicants should have an undergraduate GPA of at least 3.0. Additionally, prerequisite science courses must be completed prior to beginning the PA program of study. These prerequisites include completing several labs in the areas of microbiology, human anatomy, and human physiology. Information about our program. Those selected for entry in our program will begin an intensive program of study. Our curriculum is highly interactive and didactic. It culminates in a clinical rotation that will provide valuable on-the-job experience. It typically takes 2 to 3 years of full-time study to complete the program. Upon completion, students graduate with an MS degree. In order to start practicing as a physician assistant, graduates must pass the certification exam for state licensure.
Unit 2, Rotations. Exercise 5, page 7.
Brighton Central Hospital, PA Program Handbook, Rotations. In the Brighton Central Hospital PA program, students will complete rotations in several departments. Which departments you work in will depend in part on your interests. Mandatory rotations. All students must complete rotations in 8 regions. They will also complete 2 rotations in 2 more departments of their own choice. The 8 mandatory rotations are completed in the 2nd and 3rd year of the program. See the schedule and rotation focus below. Year 2, Summer Term. Rotation 1, Family Medicine, General Healthcare. Rotation 2, Internal Medicine, Internal Disorders. Rotation 3, Pediatrics, Infants, Children, and Adolescents. Year 2, Fall Term. Rotation 4, Gynecology, Women's Health. Rotation 5, Emergency Medicine, Acute Care. Rotation 6, Psychiatric Medicine, Inpatient and Outpatient Psychiatric Patients. Year 3, Summer Term. Rotation 7, General Surgery, Surgical Procedures. Rotation 8, Obstetrics, Pregnancy, Childbirth. Year 3, Fall Term. Rotation 9, Student Choice. Rotation 10, Student Choice. Elective rotation. In addition to the 8 mandatory rotations, students will choose 2 more. Options for these elective rotations include oncology, orthopedics, and geriatrics. Space in these rotations is limited, and so entry is not guaranteed. Students should apply for elective rotations early and must obtain recommendations.
Unit 3, Schedules and Hours. Exercise 5, page 9.
PA needed. Small family practice is seeking a full-time PA. Duties will include assessing patient condition, consulting lead MD, and directing patient flow. They will also include ordering and interpreting diagnostic procedures and tests. The PA will perform other orders as required for the management of patient care. This position requires some weekends. PA or NP. Brighton Central Hospital is hiring a physician assistant or nurse practitioner for our pediatrics clinic. Position will involve daily rounds and orders, and medication management. This position will also assess, diagnose, develop, and implement treatment plans. The schedule of this position is rotating and will involve some nights. The PA or NP will need to be on call and will be compensated for overtime. Temporary PA wanted. Western Memorial Hospital is looking for a temporary PA. This position is per diem and will require working on holidays. This position will be compensated at an hourly rate. Duties will include performing patient histories and physical exams as needed for admissions. Part-time PA. A PA is needed at Douglas County Children's Hospital. Duties of this position include completing admitting and transfer orders and discharge summaries. The PA will also perform consultations with nurses, specialists, and support staff. This position will involve 2 to 4 shifts per week.
Unit 4, Work Environments. Exercise 5, page 11.
www.westernuniversity.edu/careers/physician assistant. Overview of physician assistant career opportunities. Physician assistantship is one of the fastest growing career fields. The demand for physician assistants is currently high and is expected to remain high in the future. Physician assistants have the freedom to work in a variety of settings. Whether you want to live in a bustling city or a rural community, a physician assistant degree can help get you there. While physician assistants must be under supervision, they have opportunities to work more independently. In many states, physician assistants can treat patients without a physician physically on site. They consult with a physician, but make some decisions on their own. However, a physician assistant technically can't have an independent practice or be considered a sole provider. Physician assistants work in a variety of interesting environments. Some make house calls where they provide care in patients' own homes. Others provide medical care for uninsured or low-income patients in community health centers. Other physician assistants work in nursing homes. There, they provide long-term care for elderly, ill, or disabled people. Still others have careers in urgent care centers and government agencies.
Unit 5, Communication. Exercise 5, page 13.
Memo. From Dr. Langston Orr, Hospital Administrator, to Hospital Staff. Subject: Better communication. Recently, I've heard several communication-related complaints from both patients and staff. To prevent this, hospital staff should follow the following guidelines. There are several ways to improve communication with patients. Perhaps the most important way is to exercise empathy. When talking to patients, be sure to recognize both verbal and nonverbal cues. Also, be sure to ask open-ended questions when eliciting information. When describing illnesses or treatments to patients, be concise and avoid medical jargon. This will help the patients understand them clearly. Presenting information such as plans of care in a clear chronological order also helps. Also, understand that cultural differences may cause patients to react strangely to certain treatments. Because of this, medical staff should make an effort to understand each patient's background. These practices will not only lead to better understanding, but also lessen the patient's anxiety. Improving communication with other staff members is simpler. Staff members have complained most about illegibility of handwriting and lack of details in forms. To correct this, members of staff should make sure handwritten notes are legible. When members of staff document information, they should make it as comprehensive as possible. Thank you, Dr. Langston Orr.
Unit 6, Types of Illness and Injury. Exercise 5, page 15.
Guide to Human Biology, Chapter 12, Introduction to Disease. A disease is any condition that affects the body abnormally. These include illnesses, injuries, and infections. Diseases vary greatly in length. An acute disease, such as the common cold, will only last a short time. However, chronic diseases can last anywhere from 3 months to a lifetime. Examples of chronic diseases include cancer and most cardiovascular diseases. There are many different causes of disease. Some diseases are genetic and are inherited through a person's DNA. Others are caused by viruses or bacteria. Still others are the result of parasitic organisms such as tapeworms or fleas. Methods of transmission of these diseases vary and can occur through touch and contamination of air and water. Alternatively, a person may simply become injured in an accident. Sudden injuries often result in trauma, which can occur almost anywhere in the body. For instance, a fall or sudden impact can cause a person to rupture his or her spleen. A person can suffer from diseases at virtually any time, and new diseases may complicate pre-existing ones. For instance, diseases such as pneumonia can become complicated by additional infections. Vulnerability to diseases depends somewhat on age, though no one is completely immune. In fact, diseases can even occur before birth during any stage of perinatal development.
Unit 7, Common Ailments and Diseases 1, Exercise 5, page 17.
Patient chart. George Stedman. Medical history. February 14, 2003. The patient was admitted to the ER with a fracture of the right tibia. He also had numerous abrasions and contusions around the leg. This also caused a sprain to the ligaments in his right knee. A doctor set the patient's broken tibia and bandaged the patient's other wounds. May 7, 2004. Patient was admitted with anaphylactic shock and was given steroids to modify the immune system. He was also given increased fluids in response to a bout of diarrhea. These symptoms were caused by the patient's allergy to shellfish. December 24, 2005. The patient was admitted to the ER with burns across his chest and arms. The patient was immediately treated for shock as he had lost a lot of fluid. He was also given skin grafts. Unfortunately, the first graft failed due to an infection caused by a virus. However, the second attempt was successful. During this process, the patient also developed a peptic ulcer. October 1, 2008. The patient was admitted with acute appendicitis. Surgeons quickly performed an appendectomy to remove the inflamed organ. April 1, 2010. The patient was admitted with pain in the lower left side of his abdomen. Surgeons removed a kidney stone from the patient's left kidney.
Unit 8, Common Ailments and Diseases 2, Exercise 5, page 19.
National Health News. Rates of certain diseases on the rise. According to the Center for National Health, various diseases' incidence rates are rising. Unlike, say, arthritis, these diseases are preventable, said Jane Shepard, the CNH's director. The disease with the highest rate of increase is type 2 diabetes. Unlike type 1 diabetes, which afflicts children, type 2 diabetes is preventable. Proper nutrition and exercise are effective at preventing type 2 diabetes. Diet and exercise can also help prevent heart disease, which is also growing. 2 types of heart disease, coronary artery disease and atherosclerosis, have recently doubled. Poor diet, lack of exercise, and smoking all influence these diseases. These factors also affect the incidence of heart-related diseases such as strokes. In addition to the heart, smoking can also affect the lungs. It is a direct cause of emphysema, which occurs more frequently than ever before. Smoking may also contribute to the current rise in chronic asthma. The CNH's news is not all bad, though. According to them, incidence of liver disease, such as cirrhosis, fell in the last decade. Their statistics show that the rates of gastrointestinal diseases are also falling. The CNH attributes these changes to a rise in responsible drinking.
Unit 9. Diagnoses. Exercise 5, page 21.
Chapter 11. Medical Diagnosis. In order to effectively treat a patient, a medical professional must first diagnose the problem. Making a diagnosis, or determination of a problem's cause or nature, requires excellent skills of observation and analysis. Medical professionals who specialize in making diagnoses are diagnosticians. When many diagnoses are possible, the diagnostician might make a differential diagnosis. He or she systematically evaluates the probable causes of the problem. Then, the diagnostician uses a process of elimination to reach a conclusion. If a diagnosis is made by eliminating other reasonable possibilities, it is a diagnosis of exclusion. A medical professional's ability to recognize symptoms is invaluable. This skill is known as pattern recognition. It aids in making clinical diagnoses, which are diagnoses based on physical signs and patient-reported symptoms. Other times, a medical professional uses lab results to reach a laboratory diagnosis. A diagnosis based on medical imaging is a radiology diagnosis. All information relevant to making a diagnosis is the diagnostic criteria. Upon initial observation, a new patient receives an admitting diagnosis. Once admitted to the hospital, a patient may receive additional diagnoses. The diagnosis that is most important to the patient's treatment needs is the principal diagnosis. Based on all the available information, the medical professional makes a prognosis.
Unit 10. Treatment. Exercise 5, page 23.
http://www.centralcountyhospital.com/staff/staff/pa.html. Central County Hospital. Staff PAs. Central County Hospital employs a large staff of physician assistants. Our PAs are medically certified and have many of the same responsibilities as our physicians. They are not only knowledgeable, but also friendly. They work with nurses and physicians to take care of our patients' needs. Typically, PAs perform minor tasks, such as giving injections or sewing sutures. However, they also diagnose patients, assign treatments, and even help in surgeries. They are also assigned to record information in a patient's medical record. The hospital's PAs handle both inpatients and outpatients. Along with the nursing staff, they monitor patients that are admitted to the hospital. We always have PAs on call to assist when emergencies arise. However, they also practice medicine on patients without complicated needs. For instance, a PA is most likely to vaccinate a patient. Similarly, a PA is most likely to affix or replace a splint or a cast. Sometimes, a PA will lack the knowledge necessary to diagnose or treat a patient. When this happens, the PA will likely refer the patient to a specialist. Our PAs are trained to know when a referral is necessary. Put simply, our PAs will do whatever is required to make a patient's stay enjoyable.
Unit 11. Prescriptions. Exercise 5, page 25. Chapter 4. Writing Prescriptions. It is often possible for a physician assistant to treat a patient using over-the-counter medicines. However, many conditions require more intensive treatments that are not available to the general public. In this case, a PA may need to write a prescription. In most states, a PA is authorized to write prescriptions for patients if approved by the supervising physician. Thus, understanding how to write prescriptions is an important part of a PA's duties. There is some information that every prescription should include. It should list the exact dosage needed. It should indicate whether the patient can receive refills. And it should include an expiration date. Further, a prescription should include the route of administration. All of this information helps both the patient and his or her pharmacist to understand the intended use of the prescribed medication. A PA must include all of this necessary information in writing, but it is also important to discuss the prescription in person with the patient. For instance, most prescriptions are for pills or tablets. These require only simple oral administration, but some medicines require intramuscular administration. Patients may need some advice about how to give themselves a shot at home. A PA should also discuss any possible side effects of medicines they prescribe. Unit 12, Wound Care. Exercise 5, page 27.
Wound care. Patient name, McGinnis Colin. Admission date, 5/13/2012. Notes. Patient was admitted with lacerations around the chest and neck. The wounds were immediately dressed by the emergency healthcare team. On 5/14/2012, lacerations showed signs of inflammation and a yellowish exudate. Patient should not be released from care until the wound is clear of inflammation and ready for stitches. Be sure to offer counseling on keeping bandages clean at home. Patient name, Lee Yu Lin. Admission date, 5/12/2012. Notes. Patient suffered facial wounds and developed cellulitis. Severe desiccation of facial skin is being treated with deep moisturization. Discussed with patient the importance of keeping her hands away from her face. Eschars should be allowed to fall naturally from the skin. If she continues to scratch her face, she may cause additional scarring. It may be helpful to schedule a visit from a recovery counselor. Patient name, Paulson Petra. Admission date, 5/12/2012. Notes. Patient was admitted with severe burns on her hands and wrists. On 5/14/2012, nurse reported whitish skin around the edges of the burns. Bandages have been removed to prevent further maceration. Wounds should be cleaned twice daily. If necrosis around the wound progresses, debridement may be needed. Supervising physician recommends waiting until the slough loosens naturally.
Unit 13, Infections. Exercise 5, page 29.
The Rising Health Risks of Hospital Visits by Dr. Wilson Swenson, MD. Our patients come to the hospital because they want to improve their health. The unfortunate reality is that, for many of them, a hospital visit may make them sicker. Recent reports show that nosocomial infections are increasingly common all over the nation. Poorer hospitals have the highest rates of E. coli and staph infection. But even the nation's wealthiest healthcare facilities show rising incidences of drug-resistant MRSA infections. As healthcare professionals, it is our responsibility to ensure that a hospital isn't a dangerous place for our patients. We should be vigilant about basic preventative measures. We must not forget standard procedures like careful and frequent hand washing. Alcohol-based disinfectants are another effective way to keep doctors and nurses from becoming vectors. These simple strategies can keep you from contaminating your patients with dangerous bacteria. We should also be aware of some other common causes of infection in our hospitals. For instance, improperly installed urinary catheters frequently cause problems. We should also carefully monitor patients using breathing machines. They are vulnerable to ventilator-associated pneumonia. The best thing we can do to ensure our patients' health and safety is to pay careful attention. Many nosocomial infections can be prevented.
Unit 14, Counseling and Therapy. Exercise 5, page 31.
North Central Physician Assistant Association, June-July newsletter. Dear Association members, this month we will focus on the importance of health education. It is important that patients be health literate or able to use health information in order to make good healthcare decisions. As physician assistants, we should counsel patients on how to live healthy, balanced lives. Follow these tips to help ensure the best patient education and care possible. Make sure you discuss health risks with patients. For example, one very common health risk is obesity. Patients with this condition have a BMI that is too high. While it is important that patients understand the risks associated with this condition, it is also important that they receive professional support and advice. Provide information on proper nutrition and other aspects of preventative medicine. With the strong support of medical professionals, patients are more likely to make better health and lifestyle choices. Medical professionals working in primary care will see a wide variety of patients with many different conditions. Provide information on their options, including therapeutic treatments. Make yourself available to address patient questions and address any incorrect preconceptions patients may have. Sometimes, the initial assessment may indicate that the patient needs more specialized care. In this case, refer the patient to a specialist in that condition.
Unit 15, Career Outlook. Exercise 5, page 33.
Medical Professionals Today, August issue. The Future of the Physician Assistant Field by Joanna Myers. The job outlook for physician assistants is bright. Demand is currently high and is expected to increase in the coming years. Some employment specialists even predict a possible shortage of physician assistants in the future. Most experts agree that the career will experience impressive growth and is an excellent option for those interested in the medical field. Those currently in the field report high levels of job satisfaction. However, they do report some challenges. One of these challenges is dealing with large caseloads. Due to the high demand for their work, physician assistants often take on large numbers of patients. Some physician assistants feel that the supply of licensed physician assistants must increase to meet the needs of the labor market. Another downside is the high cost of malpractice insurance. Also, many in the field face large amounts of debt caused by taking out student loans. In order for the career to be cost-effective, salaries must keep pace with the costs of entering the field. Physician assistants must often negotiate in order to get a good salary. While physician assistants face challenges, most are optimistic about the field. The majority believe that their career is rewarding and that opportunities will only increase in the years to come.
AVN Pharma Education.